not save your life and actually could cause you harm. Well, there are plenty of individual anecdotes that may say otherwise, but it's likely that the cancers that were discovered for people 40 to 50 will regress on their own and are not life-threatening cancers. Well, that's a really hard idea to get your head around. So, you have some ridiculous statements by physicians in the media that really show a misunderstanding of how to interpret statistics and data, which I think are frightening. I mean, it's not that different than doctors 200 years ago defending bloodletting, and then 100 years later, the biggest argument in Europe was whether or not to wash your hands. And the leading cause of death in Europe was infection during childbirth. And it took 100 years to get doctors to wash their hands based on evidence. Then we turn the clock even further forward. We hurt a lot of people with thalidomide. We hurt people with calcium channel blockers. We hurt people with inappropriate use of arthroscopy, of angioplasty. We're still hurting people today by using treatments that are not evidence-based and that are not statistically valid treatments, for which we have literature that they shouldn't be using these treatments. So, we have a really deep problem with how we're training doctors. They are not being trained to be critical thinkers. I'm a huge student of medical history, and when you read medical history, it's very humbling. We have screwed stuff up and hurt people over and over and over, and we've done it with our arrogance. So, I think, we're still doing it, unfortunately. So economists, healthcare economists particularly, would say, a lot of the problems with healthcare and healthcare delivery is created by inefficiencies in the market, and if you just let the market work the way the market should work, then things would get better and things would get cheaper. Do you agree? Is that a solution, or is that not the solution to the problem as it now stands? I think it's a very idealistic solution, but the ultimate market inefficiencies are created by asymmetries of knowledge, where the customer doesn't have perfect knowledge about what they're buying. Either they don't have price knowledge or they don't have knowledge about the product. The irrational marketplace of healthcare put me out of business. So I was happily going to work every day, taking care of poor people in Camden, had a small 3-exam room office, and loved my job and loved my office. And my office is currently boarded up and closed. And it's closed because the market didn't work. The Medicaid rates kept dropping in New Jersey. And by the time I was closed, I was getting sometimes $19 to $35 per visit. And it's impossible to keep the lights on and pay the overhead. So, the irrational marketplace of healthcare didn't work.
That is, it didn't work for him. Big hospitals, meanwhile, get bigger. And with that supply, Brenner says, comes demand.
One of the problems is that we have a giant economic bubble underlying this, where we have hospital financing authorities underpinning that are run by states that help hospitals float bonds. And we have this giant bond market called the hospital bond market that's considered very secure, very safe, good investment. And, that bond market has floated too much hospital capacity and created and brought online too many hospital beds, far more hospital beds than we need in America. So, the most dangerous thing in America is an empty hospital bed. In the center of New Jersey, near Princeton, a couple of years ago, we built 2 brand new hospitals. These are 2 $1 billion hospitals, 10 miles apart, very close to Princeton. So one is called Capitol Health and the other is Princeton Medical Center. I don't remember anyone in New Jersey voting to build 2 brand new hospitals, but we are all going to be paying for that the rest of our lives. We'll pay for it in increased rates for health insurance. And boy, you better worry if you go to one of those emergency rooms, because the chances of being admitted to the hospital when there are empty beds upstairs that they need to fill are going to be much, much higher than when all the beds are full, whether there's medical necessity or you need it or not. So I'd be very worried if you live in Princeton that there are now 2 $1 billion hospitals waiting to be filled by you.
fears is unsustainable. Or maybe we should say he hopes it's unsustainable.
There comes a point in a democracy when the public's had enough and they stand up and they get upset. And, you know, the baby boomers shifted every public system they could protect. They shifted schools, colleges and universities. They changed the institution of marriage, of child rearing, of employment. I think that they're probably going to change the institution of aging, medical care, and dying ultimately. And I think you're starting to see, you know, lots of dialogue emerging about how people want to die. It would not take very much change in taste and preference to collapse the system. It's become so brittle and so overwrought and so overbonded and so overcapacity that the next great American bailout could be our academic health centers, our research centers, with a small cut in NIH funds, a small cut in Medicare payments, a small cut in the subsidies for training doctors, in what are called DISH payments. It would not take much to collapse academic health centers. And then as a society, we'd need to ask, do we want to bail them out? Are we getting our money's worth?
The humanist in me, and just the plain old human in me, agrees with you entirely about the desire and need to change and or collapse the current model. On the other hand, our healthcare spending is something close to, I believe, 20% of GDP now. Is that right?
Yep.
And I just look at that, and I look at it as if it's a mafia of some kind that's got a stranglehold, that's got so much money flowing from so many different directions with so many different avenues of revenue, many of which are, as you pointed out, counterproductive and maybe even dangerous. And maybe I just don't have the imagination to envision what kind of public response to that would collapse the system with so much at stake. Can you just tell me how to get that picture in my mind?
So no one in the CIA could imagine Mubarak ever being out of power, right? You know, complex adaptive systems go through state changes, and they do it in very complex and unpredictable ways, where one day they're one way, and the next day there's been a dramatic shift. And, you know, the way that you undermine a complex adaptive system is you begin to undermine the inputs that sustain it. So the inputs that sustain complex adaptive systems are energy, money, goodwill. And, you know, I think the healthcare system's doing a very good job of eroding all those things. You know, I don't know when it's going to happen. I don't know exactly how it's going to happen, but it's a very brittle system. It's a very leveraged system. It's hurting more and more people, not through, I don't think, an act of commission, but an act of omission. It's just its own complexity now is injuring people. The number of times I've been behind the scenes in the number of times I've been in a legislator's office and this heartrending story pours out of them about their own parents. You know, as the baby boomers are aging and people in their 40s are caring for their parents and watching what the system does to them, I think there's going to be a growing anger. You know, as the copays and deductibles and employee contributions get higher and higher, I think the goodwill underpinning the system is going to begin to break down. You know, there comes a point in a system in America where it no longer serves any of the purposes that it was originally set to serve. And America does disrupt things. You know, I don't see a lot of horse and buggy manufacturers. I don't see the steel industry here, right? You know, no one saved Blockbuster. I mean, there will come a point when, you know, sooner or later we're going to let this thing go.
Radio, we try to answer a listener's question. What's the most efficient way to exercise? Unfortunately, the answer is not what I thought it might be, listening to public radio, but believe me, that's important too.
Freakonomics Radio is supported by Organic Valley, a farmer-owned organic co-op for over 25 years, makers of Organic Fuel, a workout and recovery shake with 26 grams of protein, made from pasture-raised milk and 0 artificial ingredients.
Raise your hand if you guessed that Russia was behind the hack of those Democratic Party emails. Apparently anything really can happen this election season, and when it does, WNYC will be there to report on it, discuss it with experts, and invite you